Hey there, and welcome everyone. I'm Dr. Kelly Victory, flying solo today, filling in for Dr. Drew, who's off on other business. Super excited about today's show. Just in time for election season. Wait for it. We've got a new fear porn out there. We've got bird flu just in time. I'm shocked that it came so quickly. I barely had time to take down my COVID decorations, and here we are now. It's bird flu season. So we've got to move on. If you follow anything in the mainstream media or social media, you've got to be aware that the alarm flags have been raised, and there's a lot of fantastical headline out there with regard to incidents of bird flu. So we are going to spend an entire show today talking just about the bird flu, what it is, where it came from, what the real risks are, how the powers that be are going to co-opt this most recent outbreak. And I'm super excited to have Dr. Brian Hooker here today with me to do just that. I've had Brian on in the past. He is the Chief Scientific Officer of Children's Health Defense, a scientist of tremendous repute. He has a PhD in biochemical engineering, has done tremendous work over a period of decades on vaccine issues, vaccine injuries, vaccine safety. He was participant in exposing some fraud and corruption at the CDC in the past with regard to vaccine data, and on and on. I'll give a more thorough introduction for him when we come back, but really looking forward to getting into the weeds about this and hopefully giving, once again, facts, not fear. What really is going on with bird flu, H5N1? What do we have to look forward to? And what do we need to worry about? So we'll be back in just a little bit. I'll reintroduce Brian Hooker, and we'll get into it.
Our laws as it pertains to substances are draconian and bizarre. The psychopaths start this way. He was an alcoholic because of social media and pornography, PTSD, love addiction, fentanyl and heroin. Ridiculous. I'm a doctor, for sake. Where the hell do you think I learned that? I'm just saying, you go to treatment before you kill people. I am a clinician. I observe things about these chemicals. Let's just deal with what's real. We used to get these calls on Loveline all the time. Educate adolescents and to prevent and to treat. If you have trouble you can't stop and you want help stop it, I can help. I got a lot to say. I got a lot more to say. It's getting hotter outside, but do not let the heat keep you from a good night's sleep. Cozy Earth has the solution you've been dreaming of. Right now, you can get 30% off with the code DREW at checkout. Cozy Earth's revolutionary products are designed to keep you cool and comfortable no matter how high the temperatures. They use premium viscose from highly sustainable bamboo, and we sleep in them regularly. I wear their t-shirts. Susan wears their pajamas. Ever since we put these on our bed, I've noticed a big difference in my sleep. And here's the best part. With their 100-night sleep trial and 10-year warranty, you can invest in quality and durability with total peace of mind. Trust me, once you experience the comfort of Cozy Earth, you will not want to go back. Remember to go to cozyearth.com/Drew to enjoy that 30% off using the code DREW. And after placing your order, select podcast in the survey and then select Ask Dr. Drew in the drop-down menu that follows. Transform your sleep and stay cool with Cozy Earth. That is COZYEARTH.com/Drew.
Hey, before I introduce further my guest today, Dr. Brian Hooker, I do want to tell you all about this product that I just was eating before I went on air. Many of you who follow me on social media or hear me here on Drew or other shows know that I promote a lot of things, supplements and natural products that I believe enhance the functioning of your immune system. I don't think there's anything that's more important with regard to preventing infection, whether it's bird flu, COVID, or whatever else, and preventing things like cancers and other diseases than having a healthy immune system. I am a huge fan of medicinal mushrooms, turkey tail mushrooms, reishi mushrooms. And this company makes a great product. Actually, the website that sells this particular product, Pet Club 24/7, sells this and these and a bunch of, I actually have cookies that I give to my horses and to my dogs that contain Coriolis versicolor, which is the fancy name for turkey tail mushrooms. But I'm telling you, not only are these incredibly tasty, I could eat the whole bag, but they're actually good for you because they contain medicinal mushrooms. So check it out when you have time. Pet Club 24/7. If you go to drdrew.com/Pet Club 24/7, I believe that there's a discount code in there, but they've got a whole host of things that include medicinal mushrooms, and I'm a big fan of them. So check it out. Again, as I said, if you're reading the headlines in all seriousness, there's a lot of concern. They certainly are giving us reason to have concern about H5N1. I believe that this is the disease X that they've been talking about. I'm not exactly reading the tea leaves. I'm reading the damn billboard. They couldn't be more clear about it. I think it's pretty obvious that disease X is the next thing that's coming. As I said, the timing is somewhat suspect because of the proximity to the upcoming election. And I fear that they are going to use this as a way to, keep people in fear of going to the polls and those sorts of things. But I want to spend this entire show today talking about bird flu and unpacking it, really what it is, where it came from, what we know about it, what the actual risks are, but how, and also how the authorities are responding to it, whether it's, what sorts of measures are putting in place. Wait for it, new vaccines coming, spoiler alert. And today's guest, again, many of you have met before. I had him on, Dr. Brian Hooker. He's the Chief Scientific Officer at Children's Health Defense. He's spent decades working on vaccine safety. He is co-author of the book Vaxxed, Unvaxxed, Let the Science Speak with Bobby Kennedy. Brian is a scientist of tremendous repute. He not only has a PhD in biochemical engineering, but he has authored dozens and dozens of scientific papers. He's received many, many scientific awards. And incidentally, he happens to have an adult son with autism. I haven't asked him directly about that as yet, but whether or not he believes that there's some connection with his son's autism and vaccines. So we're going to get into all of that. He certainly knows the data. He has spent a tremendous amount of time really looking into what's going on with bird flu. So without further ado, please join me, Brian. Happy to have you back on the dais with me. Hi.
Well, thank you so much, Dr. Kelly. It's so great to be here with you. I think, there's so many important things to talk about. And you're absolutely right. We have been bombarded by fear porn now around H5N1 influenza.
Yes. So let's start with this. Let's start with just a little primer on what is H5N1, how long have we known about it? What do we know so far, independent of what we've heard in the last few weeks with these outbreaks? Give us the backstory.
Well, H5N1 is a type of influenza. If you look at the bigger picture, there's influenza A and influenza B. Influenza A is a type of flu that can transmit in animals as well as humans. Influenza B only transmits in humans. Influenza A tends to be more virulent and cause more damaging symptoms than influenza B. And when you look at, the way a lot of times people will ask, well, why is it numbered that way? H5 refers to a protein that's on the virus protein coat called hemagglutinin, and it's just the fifth variant or the fifth subtype of that particular protein. N is N1. It stands for neuroamidase. And that neuroamidase is another protein that's on the virus coat. So when you think of, H1N1, that's swine flu, H5N1 happens to be avian flu that is now mutated to transmit through herds of cattle in several states in the United States. The first sort of, if you look at this particular subtype of bird flu, it's referred to as what's called a subclade. A clade is just a different strain of this type of flu. It's mutated a little bit differently. And so the clade itself is further divided into a subclade. And this subclade is, let's see, it's 2.3.4.4b, and it was first seen in the United States in chickens in Indiana, and it was first characterized in these chickens in February 2022, like I said, in the state of Indiana.
Brian,
yes.
Let me just say, let me interject and apologize a little before you go any further down this. Correct me if I'm wrong. This should be a little bit further back. If I'm correct, H5N1 was discovered, if you will, in 1996. So it's something that was 96 or 97. That's when we first identified this virus. And we've had outbreaks, incidental outbreaks every few years since 96, I believe, with somewhere in the range of 850 maybe cases ever in humans in all of those years. Is that correct? There have been 800 and some. So since 1996. Now, one of the things that I want you to touch on is that, people have been alarmed because the mortality rate in that 800 and some odd cases was relatively high. It was something like 52% of the people died with it. But again, my understanding is that those are people who were infected largely in areas of the world that have very poor healthcare, third world countries, and places that did not have access to ICU care or to the antibiotics that would be needed to treat a bacterial pneumonia on top of it. So, so the backstory is, yes, we've known about this for some decades and haven't
since
had
1996, correct?
Yes, since 96. And so now, fast forward, we're finding this subclade that you just defined, 2.3.44b or whatever it is, in Indiana. So now we have it here. What do we know about this particular virus?
This particular virus originated in Europe and Asia. It was characterized in Europe and Asia in 2021, and probably surfaced, the particular subclade surfaced before then. Like I said, it first popped up in Indiana in the population of chickens. So it was in domestic fowl in the United States. And then it spread to several different states after that. And then I believe, and this is a question to me, somewhere in 2023 and 2024, then it started to be characterized in the cattle population. And so the transmission went from bird to bird to cow, and then cow to cow after that. And so far, if you look at the surveillance data that are, again, we kind of have to back up and define what the surveillance data are based on. But right now, it is in over 10 states in the United States in cattle, in over 40 herd of cattle. And there have only been 2 cases of cattle to human transmission. The first one was in April in Texas, April of 2024, this year in Texas. And then the second one was just a few days ago at the end of May. I believe it was May 24th, and it was in Michigan. Okay.
Okay. So let me interject again here, because part of my job is to take erudite people like yourself and then restate it for everybody who's listening who might not have a PhD, and to make sure that everyone. So number one, you've defined what is really the definition of a zoonotic virus. Zoonotic viruses are those viruses that are capable of moving between animal species. Coronavirus is also a zoonotic virus. It could move from, a bat to a mammal, to a human, to another, and then human to human. So H5N1 is a zoonotic virus. It can move species to species. thus far. And since
Correct.
1996, by the way, it has moved between birds to cattle, and with rare occasion to humans, and then almost, very, very rarely human to human. Thus far, again, correct me if I'm wrong, with this current outbreak, we have seen no
Correct.
human to human transmission. These viruses typically are a risk to people who are in direct contact with infected birds or cattle. So that would mean like poultry workers or people who work with cattle that are infected. And that's in fact what we've seen with these two cases, correct?
Absolutely correct. Yeah, and thank you for clarifying that. My sciences kind of when I get spun up for things like bird flu, my sciences hits an apex, and you have to translate it to Earth speak. And so I so appreciate that. What has happened is that these two individuals that are both dairy workers ended up with pink eye. Okay. And so when they tested them, they tested nasal swabs that came back negative, but then they tested fluid from the eyes, and those came back positive for H5N1. And then they both suffered pink eye and recovered within 3 days. Okay. And there has
So
been.
first of all, yeah. So first of
Go
all,
ahead, yes.
not only are we going to like be shoving Q-tips up our noses, but now we're going to stick them in our eyes. Oh God, I swear this is going nowhere good. Okay,
It
all
is,
right,
it is, but very, very minor conjunctivitis, and recovered quickly. And then there are no cases of bird flu that have transmitted from human to human in this particular subclade. And so I see the risk of the natural occurring virus, the naturally evolving virus. I see that as a risk of nil. I think it's much ado about nothing. And they're using faulty PCR tests. Now, remember PCR from
right.
COVID-19, right? Okay. Polymerase chain reaction. It detects they actually do what's called reverse transcriptase polymerase chain reaction, because flu viruses are RNA viruses. It's what's called a single-stranded RNA virus. So it's converted to DNA, and then it is replicated through many, many cycles. And in some instances, the tests are going up to 40 cycles of PCR, which means that you get so many false positives that it's very, it's easy to, find Napoleon's DNA in my saliva if you have 40 cycles of PCR.
Right.
It don't exist, but it can find things at 40 cycles that don't exist. Okay,
exactly. And so the way I've put this in layperson's terms with regard to the PCR is that it's a technology that was intended to amplify microscopic, minuscule bits of material so that there would be enough of that material for a scientist to study it. It was not meant to diagnose diseases the way it's used. And the example I've used is it will find and take a tiny, incidental, perhaps insignificant bit of genetic material and amplify it into something. So it would be like me finding a stray hair from my long lost dog on the floor in my office 5 years after the dog died, and then coming to the conclusion that the dog is still there because I found a fragment. The dog is not there. The virus is not there. It is, and in many cases, it's causing so we saw so much, and one of my early taglines with COVID, Brian, was that the virus is real, the statistics are not, because of these false PCR tests. So they are using this same technology now to, quote, diagnose bird flu, H5N1, and it's my understanding that they are going and planning to, or currently doing, mass testing of cattle and of birds on these poultry farms. Is that and using this as a rationale for culling these herds?
Absolutely. They want to use these PCR tests, and I've searched and searched in the USDA's website to see exactly how many cycles they use in these tests of PCR, but it really doesn't matter, because when you test PCR, you're testing for the nucleic acid material, you're not testing for the intact virus. Okay. So it might be a residue, like you said, your dear long lost dog. It might just be residue from a vestige of that particular RNA, but it does not prove that the virus is there. And so they want to use this as justification to start to test chickens and chicken farms, so they can start to call those foul. They also are using it to test raw milk and pasteurized milk. And they have found it, again, looking at a test that's not appropriate for testing these materials. They found it in raw milk. They found it in pasteurized milk. Oddly enough, even though they found it in both, they still say raw milk is bad and pasteurized milk is good. It doesn't really make a whole lot of sense to me. But they're also using it as justification then to go through these herds of cattle and isolate and then start to cull these herds as well. And so it's affecting livestock throughout the United States. And it's also then creating fear porn for, the ultimate goal or aim of human-to-human transmission.
And incidentally, by the way, no one has ever connected the dots. So what that you happen to find this virus in milk?
Right.
So what? It's a respiratory virus. Drinking milk that has this, even if they did find the virus in the milk, there's no indication that drinking it would cause you any harm at all. This is a virus that transmits through the respiratory tree. So they're just randomly doing things, in my mind, to try to amp up the concern about it. So I want to let you kind of drive this, but let's talk about, so far, the reality is we have seen zero human-to-human transmission of this virus. That said, we are well aware that there are labs, not in Wuhan, China, there are labs in the United States that are currently, and have been for years, doing gain-of-function research on this specific virus. This includes labs, the USDA lab in Georgia, certainly the University of Wisconsin. There are scientific labs doing research on this very virus and this very subvariant. So talk about what we know so far about that.
Well, there are many labs across the globe, and at least 5 different labs in the United States that are doing what is called gain-of-function research, which basically means that you take a virus that is zoonotic and you encourage it to passage through mammals and then ultimately to humans. And the ultimate trajectory of these experiments is usually human fibroblast lung culture. Fibroblasts are a type of cell that are in human lungs, and they grow these cells in culture. And the ultimate goal is human to human transmission in these gain-of-function experiments. These labs include the United States Centers for Disease Control in Atlanta, the influenza division of the CDC. It also includes the USDA, or the United States Department of Agriculture, their laboratory station at the University of Georgia in Athens, Georgia. Also includes the University of Wisconsin. Includes a research entity called BARDA, which is the Biomedical Advanced Research and Development Projects Authority, which is also a part of the Department of Health and Human Services. And they get money and they share resources with the National Institutes for Allergies and Infectious Disease. And then another entity that is, and all these labs are interconnected, and another entity that is looking at this, which really surprised me, was St. Jude's Hospital, which is working directly with BARDA and working directly with the USDA in order to produce, quote unquote, countermeasures for these humanized viruses and these humanized variants of H5N1.
And so they always use that is their excuse. That's their rationale for why they've engaged in gain of function. And to be clear, gain of function as a broad term means taking any pathogen, could be a virus, could be a bacterium, could be a fungus, could be any pathogen, manipulating that pathogen in the lab so that it takes on properties it didn't have previously that enhance its virulence. It could make it more transmissible. It could make it more resistant to treatment. It could make it more capable of spreading between species, as you're saying, human to human. Anything that makes it stronger, more capable of being a disease. So there was a moratorium. I didn't agree with much that President Obama did. One of the things I absolutely did agree with was the moratorium that was placed on gain of function research back in 2014. That ban, that moratorium was subsequently lifted. Unfortunately, despite the fact there was a moratorium, Anthony Fauci and others continued gain of function research on COVID, and that is clearly, it is irrefutable that is what produced COVID-19 was gain of function research that occurred in the lab in Wuhan, China. Now, you're telling us, or you're verifying that they are doing gain of function research here in the United States on H5N1 specifically with an intention of making it transmissible human to human. And it's my understanding that it doesn't take much modification of, I can't remember who said it, I'm blanking on who acknowledged it, that it takes only like 4 minor changes, genetic changes in the laboratory it's not a big leap to make this all of a sudden very transmissible human to human. Is that correct?
Absolutely correct. It would take about 4 or 5 mutations that would result in different amino acid sequences in the proteins associated with the virus. The person who stated that with a really ominous warning was the former CDC director, Robert Redfield.
Right. That's right.
And he started talking about it 2 years ago. He has since said that disease X will be bird flu, that it will be man-made, a laboratory leak, whether you believe that it would be an intentional leak or an unintentional leak. But there's much money to be made. And when you follow the money trail around these labs that are doing gain of function research, you see that these individuals, these principal investigators, here's Robert Redfield, and he says that the mortality could be significant in the 10 to 15% range. That is much, 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 much higher than what we saw with the COVID-19 virus itself. And so, there's fear porn in here, but the reality is that these labs are working very, very hard. And, the type of research, the type of modifications that are needed in order to make this transmissible are already on the books. It could have been done yesterday.
Right. And the reality is this, this doesn't have to be released by nefarious intent. Lab workers are humans. Humans are fallible. Unfortunately, people don't understand the frequency of lab errors and lab accidents is high. They happen.
Yes.
They don't get reported to the public, but they happen in the hundreds a year. Get reported that there are lab incidents. Okay. Everyone thinks that these are super top secret. Absolutely nothing ever happens. That isn't the case. People drop a test tube. People, break protocol. It happens all the time. So the idea that this is going on, it's very dangerous business in the first place. Then I will submit, and I'm not a conspiracy theorists. I will tell you the facts, though, which is that a lot of these scientific labs, including places like the University of Texas in Galveston, my alma mater, the University of North Carolina at Chapel Hill, Stanford, Yale, University of Wisconsin, they are funded by the Chinese. They take in huge amounts of money from foreign governments. There is, follow the money here. There is participation in many of these labs with foreign entities and with foreign governments. So we're going to come back. We're going to go to a break and come back. I want to talk a little bit more about gain of function. And then I want to hit what I know everyone's waiting for is where are we going with their, I guarantee they're running the new mRNA vaccine for bird flu is going to get run up the flagpole. So we'll come back and hit that after the break.
Let's talk about aging, because everyone wants to know how to slow it down. For almost a decade, I've been taking a healthy aging supplement called True Niagen. This supplement boosts NAD, that's something that cells can't live without. It's done with a patented form of nicotinamide riboside called NR, or Niagen. It's more efficient and more scientifically reviewed than NMN or other NAD boosters. True Niagen is truly the best way to boost NAD levels, and it's made by Chromadex. They're the gold standard in the NAD space. Dr. Charles Brenner, the scientist who discovered the NAD boosting potential of NR, explains.
And the center of the metabolism that allows the conversion of food into energy is NAD coenzymes. And NAD gets disturbed in the aging process. And as we're exposed to conditions of metabolic stress, Niagen, which is the form of NR that was developed by Chromadex, is the best and the only fully legal form of NR. And this is really the gold standard for NAD boosting vitamins.
I love this product. I urge you to try it. Go to drdrew.com/True Niagen for 20% off your order. That is drdrew.com/True Niagen, TRUNIAGEN, and enter Dr. Drew at checkout, DRDREW, enter it at checkout for 20% off. You can spend thousands of dollars and dozens of hours trying to look a few years younger, or you can skip all that and the hassle and go with what works, Genucel Skincare. Genucel is the secret to better skin. Their products are made in the USA using a proprietary technology that combines a naturally effective base with non-GMO ingredients. In fact, you might have witnessed the astonishing effects of Genucel during a recent unplanned moment of our show, when just a little Genucel XV restored my skin within minutes right before your eyes. That is how fast these products work.
I know I'm a snob about the products I use on my face. Everybody knows it. Every time I go to the dermatologist's office, they're just rows and rows of different creams. Retinols, vitamin C cream, under eye cream, night creams.
Scrubs.
And then when I get to the counter, they're overpriced. All kinds of products that you can all find at Genucel.com.
Susan and I love Genucel so much, we've created our own bundle so you can try our favorite anti-wrinkle creams, correcting serums, under-eye treatments. Say goodbye to those fine lines, forehead wrinkles, skin redness, even those dark under-eye bags. Women and men of all skin types, Genucel has got you covered. Order right now at Genucel.com/Drew to save 50%, actually over 50%, and you'll get a free luxury spa box plus free shipping. That is Genucel.com/Drew, GENUCEL.com/DREW. There are 4 distinct and outstanding medical kits from the Wellness Company: a first aid kit, a travel emergency kit. I was very instrumental in developing that one. I love it. A COVID emergency kit. But let's unpack their medical emergency kit, the one that gives you immediate access to treatment for a variety of medical conditions. Here's the kit: pneumonia, upper respiratory infections, skin infections, gastrointestinal infections. You'll have on-hand medication that will even serve as immediate prophylaxis against a sexually transmitted infection, rapid intervention for Lyme and other tick-borne illnesses. Of course, we've added Tamiflu to our kits in case the avian flu should become human-to-human transmissible. Then we know something is up and we want to be ready. And look, we want to be covered for bioterrorism even. And of course, the Nobel Prize-winning antiparasitic ivermectin, and a how-to guide and a virtual consultant. Get access to these prescription meds by going to drdrew.com/TWC to save 15% off. That is $30 off the medical emergency kit. drdrew.com/TWC for 15% off the kit and any of their kits or their supplements. Do it now. drdrew.com/TWC.
There's nothing in medicine that doesn't boil down to a risk-benefit calculation. It is the mandate of public health to consider the impact of any particular mitigation scheme on the entire population. This is uncharted territory, Drew. Welcome back. I'm here with Brian Hooker, and we're talking all about bird flu, what's real, what's not, what we know, what they'd like us to believe. Brian, I just said we were going to talk about the mRNA and where they're going with that. And I want to do that. But before I do it, I think I threw you off. I kind of glossed over something that's critically important. We were talking about them using these faulty PCR tests and everything as a rationale to cull the poultry, birds, and potentially cattle, rather than allowing this virus to just run through them. Some birds will die, most won't, and they will develop natural immunity. They're using this testing as a rationale, and they're talking about culling, millions of birds. I think just in Iowa, on one farm alone, they're talking about killing 4.2 million poultry fowl. Okay. The kind of impact that would have on the food chain, is overwhelming. So, talk about, it's not only unnecessary, it has, I believe, an ulterior motive when they start talking about wiping out this much of the food supply.
Well, I think when you look at it at its core, it is an economic disaster. It's an economic, for the farmers themselves that have to, are being ordered to cull these herds. It's an economic disaster, but it also promotes sort of alternative technologies. I find it odd that a lot of this is happening by the USDA, but yet the USDA is the one that has genetically modified chickens that are genetically modified to be immune to influenza, to bird flu. And so, of course you cull the herds, and then you can introduce a genetically modified product. And we're being trained more and more as a society in the United States to accept more and more different types of GMOs. And I don't think that this is any accident at this point in time. That, I think it's quite an opportunity rather than to let the virus run its course. It's an RNA virus. RNA viruses mutate quickly. When they mutate, they become less virulent. In general, as long as they're not hampered by vaccinia technologies. There was a whole series of studies done in 2015 with chickens and Newcastle's disease that showed this very, very elegantly, that if it were let to progress through the chicken population, then it would become very, very benign. But yet that's not what they're doing.
Exactly. And certainly if we learned anything from COVID, and this was, I preach this daily, when all viruses mutate, when they mutate, they do two things with incredibly rare exception. They become more transmissible and less virulent. They become weaker and weaker, and they spread, and they become more akin to a common cold if you just let it run its course. And the animals, including humans, will develop natural immunity along the way. And when they start interfering with it by failed vaccine programs, for example, they drive mutations and they wreak more havoc. But I think we can't overlook the impact of this issue of impeding the food source, culling herds unnecessarily. And anybody who watched my show some weeks ago with Ivor Cummins, when we were talking about the multi-pronged assault on humanity, it's not just an assault on the borders and on education, but this war on the farmers is huge. Elites have an agenda with regard to pushing us away from animal sources for food. And I don't care, if Nicole Kidman wants to eat bugs for a living, crunch away, girlfriend. I don't care. You be you. But, I intend to eat meat. And I think people have a right to do that. So I really am concerned about not only, what it's going to do to the farmers, but the cost of food and the availability of meat products if they continue down this path. So now let's talk about, yes, we know, and it was totally predictable that they would launch and be right at the, Johnny on the spot with a new mRNA, quote, vaccine for bird flu. So talk about, at least, what we know, Brian, about the state of mRNA vaccinology for H5N1.
Well, this is hot off the presses. I'm glad that you featured this article because it's the University of Pennsylvania that is working directly with the other entities that are doing gain-of-function research in order to come up with an mRNA vaccine. Again, this technology that has really devastated the United States population and really the world population. We've seen more VAERS reports for these mRNA vaccines. VAERS is CDC's surveillance system of vaccine injuries. We've seen more VAERS reports for mRNA vaccines than all of the rest of the vaccines in the entire 32-year history of that database combined. Okay, and so there's more trouble. There's more money to be made, as well as you look at these outfits like the University of Pennsylvania with their patent portfolios, with their licensing agreements, and you also have to bear in mind that there was an incredible amount of money that was made from the COVID-19 vaccine. Over $100 billion was gained by Pfizer and Moderna over the course of the pandemic for these vaccines. Now there is a big void because less and less people are getting their COVID-19 boosters. So this is being rolled out as the ultimate savior for the bird flu pandemic.
Yeah, and I will tell you, I said from the very beginning of the COVID pandemic, Brian, that I believe that one of the primary goals of the COVID pandemic was to make mRNA a household word. To make people believe that this is a platform that's been well established, well tested, completely safe and effective. It's good for everybody. It's good for kids. It's good for old people. It's good for pregnant people. It's good for, safe for everybody. We've done it for years, when that is not the case. Yes, scientists have been working on mRNA for a long time, but mRNA vaccines have failed every single time in the past, sometimes with devastating results, where all of the test animals died, for example. But they fast-tracked the COVID mRNA shots, and we lived through that for years. You rightly point out, we are seeing carnage in the wake of that failed program, but they have led people to believe, oh, it's just another mRNA vaccine, as if the platform headed. And so now, rather than testing, having to go through the testing for that platform, they've just acted like they got a pass, and now we can make everything using mRNA, which just is not the case. Furthermore, there's an adage in pandemics and vaccinology and virology that you never launch a mass vaccine program in the midst of a pandemic, in the midst of an outbreak. Talk a little bit about why that is. What is it? Why do we not start vaccine programs when there's an active outbreak?
When you have an active outbreak and you introduce a vaccine in it, then what would normally happen with the evolution of a virus is reversed. Okay. And so, again, going back to, there were some seminal studies that were done in 2015. One of the lead authors, his last name was Reed, R-E-A-D, on chickens and Newcastle's disease. The vaccinated birds, when you had an imperfect vaccine, which all vaccines by definition are imperfect, none of them have 100% prevention of the disease. When you, and I would call this, for lack of a better term, a leaky vaccine that doesn't prevent transmission, then the reverse happens to the virus as it circulates throughout the population. It becomes more virulent as more of the population has sort of imperfect, inferior vaccine immunity. Then that allows the virus, it creates what's called selection pressure in viral evolution that creates a virus that is more virulent, and it will cause more carnage and will cause more death.
And this is exactly what we saw with the COVID vaccines, quote unquote.
Right.
And the Cleveland Clinic did a huge study. I have 53,000 patients that showed that the more highly vaccinated you are for COVID, the more likely you are to get COVID. It's why the people who are highly vaccinated are the people who've had COVID 5, 6, 7 times, where the average person who's not vaccinated for COVID got it once or maybe twice, and very mildly at that. So it drives, when you have a leaky, or what we call scientifically a non-sterilizing vaccine, one that doesn't
Correct.
prevent the animal, including the human, from contracting the disease, you actually cause it to mutate more quickly and differently than it would if it went naturally through the herd. And we saw this, for example, the French did a very failed experiment. They tried to vaccinate mallard ducks. They tried to vaccinate ducks for bird flu. Mallards have a long migratory path. They cohabitate with other poultry, fowl, and cattle. And they ended up, instead of letting the flu go through the mallard duck population and let those birds just develop immunity, they instead spread a more virulent form of the flu to other poultry, birds, and to cattle. So it never makes sense to do it. I don't know why, we are not learning from past mistakes. It really begs the question. What are you seeing happening? You're looking at this real time. What is the state of the vaccine programs right now with regard to at least poultry animals and cattle and that sort of thing?
Well, right now, what they're doing in terms of the human vaccine itself is that there are already 3 approved versions of H5N1 for human use in the United States. And so they're stockpiling those vaccines in the National Vaccine Stockpile. On top of that, they have what's called a viral protein code vaccine. The patent is held by a company called Novavax. And actually, the person who is responsible for a lot of the fear porn on Twitter regarding bird flu, his name is Rick Bright. He is one of the co-inventors on this patent. And that vaccine right now is in preclinical trials. And so that will be an alternative to the mRNA vaccine. And then the mRNA vaccine itself for bird flu is entering into clinical trials. Regarding, and I'm loath to say, Dr. Kelly, I don't know as much as I should regarding the vaccination that's going on with chickens and also with cattle right now. I haven't been following that as closely, and I do apologize for that.
Well, Rick Bright. He's the gift that keeps on giving.
Right.
Let's talk about. Okay, so here we are. We've laid it out here. We've got so far 2 people in the United States who have tested positive for H5N1 who had pink eye that they got from a cow. Okay.
Right.
Yet, despite that's the state of the of the quote outbreak. But we have the U.S. government manufacturing and stockpiling human vaccines for this. Okay, you start wondering, what is it they know that we don't know? So let's look at this at Rick Bright and what his investment, what his motivation is. Put up, Caleb, there, he made a great statement. Let's start with Rick Bright's statement about his Twitter post. This is, here he is, talk about the purveyor of sound the alarm, the purveyor of fear power, and is right. He is talking about and predicting that it's going to become, any threats to, any attempts to minimize the threat are irresponsible. So here I am, apparently being irresponsible. What I am saying is, if this virus starts to behave differently, if it starts to do something different from what it has always done in the past since 1997, I'll go out on a limb and say you can pretty much guarantee it's because the virus was manipulated in a lab to do something different. Because left to its own, in nature, H5N1 does not cause massive pandemic outbreak, and there is no need or an mRNA vaccine or any other fear. It's only going to be if it all of a sudden was manipulated purposefully in a lab to do that. Do you think I'm overstating that, Brian?
I think you're absolutely correct. And when you look at Dr. Bright and what he's done, he was in the thick of the gain of function research that was done on H5N1 influenza. And he has a portfolio of no less than 20 patents from his time at BARDA. And the sort of ultimate patent that he has is around the bird flu vaccine that is now being pushed through clinical trials by Novavax. And so, this type of, he was at Novavax from 2006 to 2008, went to a different company in Vietnam called PATH, started at BARDA 2010, and was the director of BARDA up to 2020. And while he was at BARDA, he was pursuing these patents. He was getting these patents licensed at the same time. And he was one of the co-authors and one of the co-investigators in the gain of function research.
Yeah. And so, again, at this point, as I sit here today, there is no reason for panic. We have not seen any human-to-human transmission, let alone rampant human-to-human transmission. I'm not saying it's not possible, however, because of what they are doing and because we know, as Robert Redfield acknowledged, it takes very little lab manipulation to create a version of H5N1 that could easily transmit. Now, the good news is, again, since people, I'm assuming, have this question, well, gosh, what do we do? The great news is we have every reason to believe in good studies that show that H5N1 is highly treatable with chloroquine and its precursor, therefore hydroxychloroquine. We knew that COVID would be because SARS-CoV-1, the precursor to SARS-CoV-2, was highly treatable by both chloroquine and hydroxychloroquine. By the way, Anthony Fauci knew that too. It was under his tutelage that they published the study on it in 2005. So the idea that they acted as if they didn't know this was preposterous. Good news, looks like H5N1 will also be highly treatable with chloroquine and hydroxychloroquine, and frankly, very likely ivermectin and some of the other drugs that we treated SARS-CoV-2 with, COVID-19. In addition, we've got things like nasal sprays and gargles, the most simple things like, povidone iodine and a little bit of salt water sprayed up your nose, those sorts of things. And if I were a poultry worker, working with potentially infected birds, I would be using that on a daily basis, just gargling and doing nasal spray, because this virus is very susceptible to it. So again, we are the porn. We are against fear. I coined the hashtag, Ryan, facts, not fear, back early in 2020. And I believe that the antidote to fear is information and preparation. And so that's why I think it's so important for you to be here exposing this. You have spent decades in vaccine research. You obviously were very, very critical in exposing previous vaccine research corruption, and that's what it is. It's nothing short of corruption within the CDC. And you and Bobby Kennedy wrote the book, Vaxxed, Unvaxxed, Let the Science Speak. Take a few minutes, and give us the broader purview, the broader look at your feeling about what you've uncovered in your decades of research and investigation about vaccines in general.
Well, what I found is that since the 1986 National Childhood Vaccine Injury Act and the addition of so many vaccines to the infant childhood schedule, that this has become so much more about profiteering, about monetary gain, about horrific conflicts of interest within, sort of the three-letter agencies of the Department of Health and Human Services. And it's so much less about saving children and providing the most optimal health that we can for our children. For me, Dr. Kelly, it took my son's own vaccine injury in order to open my eyes. I was very, very pro-vaccine growing up, even through, graduate school and getting my PhD. I didn't really know that vaccine injuries were a thing. And, it wasn't until my son received his 15-month vaccines in 1999, all while he received 3 vaccines that day, all while having an active ear infection, and suffered an encephalitis from that, and then was diagnosed 3 months later with full-blown autism. And, it was plain as a nose on your face what did it, because he lost his ability to look me in the eye, look my wife in the eye. He lost his language pretty much overnight after he had fevered after receiving those vaccines. And so, my eyes were opened, and I saw this, happen in real time. But he had no business getting vaccines that day. He had an active ear infection. He received a live virus vaccine and 2 adjuvanted vaccines all at the same time. It was the perfect storm. But that opened my eyes, and that led me on a journey, looking specifically, investigating the CDC and investigating, collusion to commit fraud, to preserve the vaccine program, not to save children's lives, but in order to save jobs and to make a lot of money.
Yeah, I think it's a tragic story. I am so sorry to hear it, but it's a story I hear over and over again.
Right.
I spoke recently at an event for the Vaxxed Unvaxxed bus up in Spokane, Washington.
Oh, wonderful. I
And
missed you.
heard,
I wish I was
yeah,
would have been there. Yes.
well, and I heard this same story over and over again. Like you, I had been called a vaccine zealot in the past. I
Right.
spoke and wrote prolifically on the importance of vaccines. I was a huge believer in them. I am heavily vaccinated myself prior to the COVID. I have more vaccines on board than a lot of people because of where I've traveled in the world and what I've done for a living. And then I had my eyes opened, and it's really been an existential crisis on my part as a physician to understand that so much of what we were taught in medical school, so much of the narrative has been a big lie. That what's written
Right.
in the journals are fundamentally the marketing arm for big pharma, and that the science, quote unquote, behind vaccines is very, very poor, heavily corrupted, and outright fraudulent in many cases. So I heard stories like yours, tragically, from parents who said, look, it was very clear that change in my child happened within hours, 24
Right.
hours of receiving a vaccine. The vaccine was clearly the proximate cause of this neurologic injury. And I think we are obligated as a profession to be introspective and open and honest about what's gone on here. So I really applaud you for your bravery. Where do you think this is going from your perspective? You're sitting kind of from your purview. What do you think is going to happen? Do we have more people getting on board, or where is this going to take us?
Well, it's very difficult staring down the barrel at a potential H5N1 pandemic and then having more of the same. It's like a rerun of I Love Lucy. I mean, here come Lucy and Ricky and Fred and Ethel, all come back again with an mRNA vaccine that's in clinical trials right now that is going to save the world. But when you look at what's happening, about 4% of the parents surveyed prior to the COVID-19 pandemic questioned the vaccine schedule for their children, actually questioned it and maybe opted out of one, several, or all of the vaccines. Now, when that same survey is done, it's about 30%. 30% of the parents are actually asking questions good questions for their practitioners. Hopefully they're getting good answers from their practitioners, and hopefully they're looking for good sources of information from those practitioners. But honestly, I think more and more people are waking up as the powers that be that foisted these vaccines on us very, very early without sufficient study, not even a drop in the bucket of sufficient study. People are really, really opening their eyes, and they're seeing, fool me once, shame on me, fool me twice, shame on you. And I'm sorry, opposite of that. But more and more people are starting to wake up, and they're asking good questions of, their practitioners, and they're going to alternative sources for information. More and more people are also realizing that it's all about money. I mean, we now have this money void because less and less people are vaccinating for COVID-19. Less and less people are getting their boosters. And so, of course, they're going to have to roll out another pandemic because we've got this bloated, $100 billion worth of sales that went to Pfizer and Moderna, and they have to replace that somehow.
Yeah, well, I think that's you really hit the nail on the head. I mean, I think that there are other nefarious forces, but money is you start with that, right. And it's clear that the U.S. government has a massive investment in mRNA technology through BARDA, the CDC, the FDA. They have massive amounts of money set aside for this. The Department of Defense does, and right. They have to do something with this. So they have created, I believe, the next thing that would require an mRNA platform. There clearly are players out there like the, Bill and Melinda Gates Foundation and others who would love to see this. The World Health Organization, Tedros has already been, promoting the idea of an mRNA vaccine for all kinds of things, including Correct. Bird flu. And this is absolutely where they want it to go. But I think the bigger picture in my mind as a physician is, when did we adopt the idea that we needed to vaccinate our way out of every single infectious disease out there? I mean, I hate to break you that there are myriad viruses and bacterium and pathogens out there. Lord, I mean, what you come into contact with on a daily basis, and your best defense is an immune system worth its salt, right? I mean, did you ever think we would get to the point where we thought we needed a vaccine for everything?
It is untenable what is going on when you look at the addition of the COVID-19 vaccine to the infant-child schedule of vaccinations. That is now 56 different vaccine doses before the 18th birthday, and over 30 vaccine doses in the first year of life, and including an mRNA vaccine that causes innate immune suppression. So we're going to have sicker children. It shows, I've got studies that Mr. Kennedy and I found in our book that showed that influenza hospitalizations went up when you got more annual flu shots. The more annual flu shots that you got, right. The more susceptible you were to being hospitalized against, you named it, influenza. And so, we're really destroying the natural immune system. And less of this sort of control group that did not get vaccines growing up is around. And I think that ultimately the powers that be would love to destroy that control group, because, whenever I spent a large portion of my career studying this control group, vaccinated versus unvaccinated children, vaccinated versus unvaccinated adults. And when you look at that control group, they are very, very healthy. They've got intact immune systems. They're not coming down with an ear infection a month, which was sort of my history with my son before we stopped vaccinating him. He was a walking ear infection from 6 months to 15 months. And yet that was really, when I started studying the unvaccinated, that was the first thing that stuck out, was many of these families had not experienced a single ear infection. And for me and my experience with my family, that was something, from Pluto.
And to be clear, Brian, this isn't
Yes.
just about infectious disease. That flogging the immune system in the way that we do with 56 vaccines, 30 in the first year of life, flogging the immune system doesn't just put people at risk for infectious diseases, whether it's a
Right.
ear infection or otherwise. It's a whole host of immune issues, not the least of which is cancer.
Correct.
Autoimmune issues like Crohn's disease, multiple sclerosis, all of these things, eczema, psoriasis, peanut allergies, asthma, you name it. All of these things are immune mediated processes. And if you look at the unvaccinated populations, say the Amish, for example, the incidence of autism or, food allergies, psoriasis, Crohn's disease in the Amish is fundamentally zero. I mean,
Correct. I
it's
couldn't agree more. You look at, there was a journalist who used to work for the UPI who passed away several years ago. His name was Dan Olmsted, and he studied the Amish, and the only Amish autistic children that he could find had actually been adopted into an Amish family after they had been vaccinated. And really, other than that, those that were growing up in the community, born in the community, raised in the community, there was virtually no autism in that. The other thing that really sticks out is that a lot of these children and adults with autism have other disorders. My son has Crohn's disease. A lot of autistic kids have eczema, psoriasis. And other autoimmune conditions. We treat my son with a biologic because of his ulcerative colitis and his Crohn's disease. And, so when you look at immune dysregulation, it can go a variety of pathways. And a lot of times, like in the case of my son, it can go multiple pathways as well.
Yeah, it's really tragic. And again, I would submit that if I would happily have this debate with anyone on the other side, if they feel that there's no way that it's vaccines, I'm open to that. I'd say, great. If you don't think it's vaccines, awesome. What's your theory? What's your theory for what's causing all of these things? And they don't have a theory. And so I'm saying, we are obligated as scientists to look at patterns, to observe what's happening, to look at the incidence, and in this case, the wildly increasing incidence of these different things, these different conditions, and say, if you don't believe it's the vaccines as the proximate cause, what do you think it is? Because we have got to come to some answers for this. So, I can't tell you how much I appreciate your time. I know we're flashing that we're actually over time and the time has flown by. I'm hoping that we provided folks with some additional information about bird flu that will, again, fill in with facts what's actually happening and heighten just be aware of what it is that's coming. If we start having those human to human cases, then, you heard it here first. We know what's causing it.
Right.
And again, there are other ways to handle this other than an mRNA shot. That is not the answer here. So anyway, thank you. I hope that you will continue to come back with updates. This is not the last of it, Brian. Again, spoiler alert, this is not going away. So really, I'm hoping you'll come back in some weeks with an update and hopefully some good news about where this is going. But thanks again for coming.
Well, thank you, Dr. Kelly. It's always a pleasure, and I would love to come back. I appreciate that.
Terrific. We'll see you soon. Caleb, I think you're going to put up the upcoming schedule for Drew. I think Drew is back. I don't know when he's back. Drew, there you go. Yep, June 4th. You've got Andrew Gruel, that'll be a fun show. So you've got some good shows coming up, including with Naomi Wolf. I'm sure she's giving lots of updates on what's going on. I just did a show with her recently. She's always fired up. You've got a great list there. So Drew will be back on the 4th. And in the meantime, everyone, facts, not fear, no reason for panic. Keep a healthy skepticism. Healthy skepticism and healthy immune system is what you need to fight off what's coming next. So cheers and thanks for joining us.
Ask Dr. Drew is produced by Caleb Nation and Susan Pinsky. As a reminder, the discussions here are not a substitute for medical care, diagnosis, or treatment. This show is intended for educational and informational purposes only. I am a licensed physician, but I am not a replacement for your personal doctor, and I am not practicing medicine here. Always remember that our understanding of medicine and science is constantly evolving. Though my opinion is based on the information that is available to me today, some of the contents of this show could be outdated in the future. Be sure to check with trusted resources in case any of the information has been updated since this was published. If you or someone you know is in immediate danger, don't call me, call 911. If you're feeling hopeless or suicidal, call the National Suicide Prevention Lifeline at 800-273-8255. You can find more of my recommended organizations and helpful resources at drdrew.com/help.